Most of us think that the annual physical is enough, but what if it's not even scratching the surface? Today's guest, Dr. Luke Sorrell from Gladden Longevity, he's going to pull back the curtain on the cutting edge tests that can reveal how fast you're aging and how much time you have to change your story. So these advanced tests that we're going to talk about for your heart, your lungs, your gut, your biological age, these tests can help you detect problems years before they show up. So make sure if you're 50 or older, you want to live longer, tune in.
Grab a pen, grab a pad, put everything aside, dig into this thing. You are going to learn so much out of this episode for longevity and your overall health. Thanks, Kelly. Let's get to the episode. Okay, Dr. Luke, welcome to the show. We have a really exciting show for you today. I don't want to waste any time. So, Kelly, would you mind doing a proper introduction for Dr. Luke, and let's dive into today's topic?
Absolutely. We are so excited about today's topic with Dr. Luke Sorrell, who is with Gladden Longevity. And Dr. Luke knew early on that he loved science and he was drawn to help people. So medicine was just a great fit. So he got his degree from Abilene Christian University, and he attended medical school at UT Houston, and he also did his medical residency at Baylor. And he spent his career as a hospitalist, but then he realized after doing primary care for a while that he really valued the patient relationships, and he was really getting frustrated with what he calls a reactive traditional medicine. So seeing the consequences of late diagnosis, he just decided to take a more proactive approach, and that journey brought him to functional medicine and longevity medicine. And it brought him to Gladden Longevity Clinic, which is where I got to meet him. And I just love his mission. And we're so thankful that we're here today and we're going to dive in. So, Dr. Luke, thanks for being with us.
Thank you for having me, Kelly. I appreciate that introduction. I'm excited to be here.
Excellent.
So maybe you could share with our audience your backstory of how you started out in, I guess you can call it traditional medicine, and what made you shift, and anything that our listeners or viewers could dig in about your kind of history. We'd love to hear that first and foremost, if you could.
Yeah, absolutely. So I started out my career as a hospitalist. So I basically just practiced in the hospital, admitting sick patients, treating them there, discharging them. But after doing that for about a year, realized I wanted something a little more structured, stable, shifted into just doing primary care work. So worked at a clinic, saw patients for physicals, traditional primary care type stuff. But as I progressed through that, I began to kind of see that a lot of the time for lots of patients, I felt like the intervention was done too late. If we had been maybe a little more thorough or a little more careful in screening, or just done more tests, we could have picked up on things earlier, maybe detected the cancer earlier, maybe detected the shift towards type 2 diabetes earlier, maybe cardiovascular disease kind of creeping up. We could have detected that earlier. So things were just, I felt like, being diagnosed real late. And yet we have technology and testing available to pick these things up much earlier and then mitigate them much sooner. And so I began to see that, and then I began to just get introduced to some of the functional medicine, integrative medicine, longevity medicine, whatever you want to call it, but to the testing that's involved with that, and just began to see that this was really the way that medicine needs to kind of move, and subsequently kind of shifted my career towards that, and that's how I ended up here with Gladden Longevity, where I'm practicing today.
Yeah, I was going to say, so what about the traditional physical just was not cutting it? So what happens, even some of the executive physicals that people go to that are a little more extensive, where are they missing it?
Yeah, I think that it's just very cursory. And part of that isn't the physician's fault. Part of that is is due to time restrictions. Maybe you've only got 15, 20 minutes with the patient. You don't quite have enough time to really get into depth on a lot of this stuff. And so there's time issues, and there's only so much that you can really get at with a basic exam, kind of listening to the heart, the lungs, kind of a cursory physical, and then you run a few labs, basic labs, and so there's just not a lot of depth to that. And we have access to so much more that can give us so much deeper understanding of what's going on. And so it's limited, I would say, due to time and due to the testing that's being done.
I saw a statistic, and it may not be true, but the average visit time with the doctor is about 7 minutes, and they leave with an average of 4 to 5 prescriptions, and most of them are for life. Is that somewhat true?
That's accurate. Yeah, that's accurate. I mean, I think, there's a shortage of physicians for sure, and so they're pressed for time, and so they're really trying to get through these visits. And I think they, you tend to just reach for an easy fix a lot of times, which tends to just be a prescription. And once something gets prescribed, it doesn't get de-prescribed very easily, and so it just tends to stay on for life for the most part. And then you could see how things just slowly build up, prescription after prescription, and then you're out taking 10 things, and some of these things are helpful, some of these things are necessary, but a lot of the time we can look deeper and see more of what's going on that maybe no one's seen before, that maybe we could address through other means, not necessarily need that prescription. So I think that's where medicine's kind of moving, and that's where we're focused on here at Gladden Longevity, is getting more to the root issues, uncovering more things through testing, and so we're really pushing that forward.
I think most people expect to walk out of a doctor's office with a blue slip at this point. So it's become
Well, you're right.
You want to. If you don't have one, it's like, what the heck? I'm doing something wrong here. So So that would be reactive care, or really where our whole medical industry has been as a whole for many years. So you grew you saw the light very quickly, and that's pretty amazing. I mean, you've only been a doctor for how many years at this point?
About 5 years.
So you saw the writing on the wall very, very quickly, which is a phenomenal thing. So now you step out of that, then you hooked up with Gladden Longevity, and that's what I really want to dive into today. This is such a meaty topic. I mean, I got Dr. Gladden's book here. I'm about a third of this way through this. I know Kelly's got it through. This thing is so darn meaty, guys. It is as meaty as it gets, but it is so detailed. I just lost you guys on my screen here. So hang on a second.
You're there. You're good.
Okay, cool. So let's dive into where we're at today, and what the heck is going on, what people can do for their longevity. So, I mean, lots of stuff.
Yeah. So I was going to say, when clients are coming to me for nutrition, fitness, life coaching, some of them are on 10 different medications. And I'm thinking, nobody has studied how these 10 medicines work together and in this body. Like, that kind of stuff just blows me away. And also, when I owned my health clubs, I used to have naturopaths that worked in the health clubs, and someone would bring them the blood work and everything would say within normal limits, but they would look at it so differently. And they're like, well, yeah, but because potassium's on the edge here and calcium's on the edge here, and then it's just a whole new set of eyes that you're able to look at. And I know you do more than just blood work there. So if we could start to dive into the testing.
Let's talk about the overall vision you guys have and what you teach. I want to go on through that, because the Symphony of Longevity, I think it was referred to in the 4 pillars. I think that, can you share or enlighten us on how you kind of view longevity as a overall?
Yeah, no, for sure. So we try to kind of structure it, because it's a big topic, and I think it's a big thing to tackle when we're approaching longevity, you kind of have to break it down into pieces. And that's kind of what Dr. Gladden has done with his book and with his circles. And so he kind of breaks it down into life energy, which is kind of more of a psychospiritual realm, which we know is super important for healthy aging. If you're not grounded in a psychospiritual sense, then it's going to lead to disruption in relationships and nervous system and different things like that. So very, very much important. And then the different circles of longevity in terms of actual health, performance, fitness, actual longevity biomarkers, all that we kind of piece in these different circles, and we can kind of show how they intersect with each other. But it just gives us a bigger framework for how all this stuff fits, and then how we kind of piece testing in through that.
Excellent. So the early detection, obviously, you said before, the earlier that we can find something, the better chance that there is to intervene before significant damage is done. And then the longer and healthier that people can live. So, Mark, you ready to dive into some of the tests?
Let's dive into the tests. Yeah,
Okay.
whatever you can teach our listeners and viewers that they could apply to their life is going to be so beneficial. Because there's a lot.
Let's start with cardio. The cardio tests? Yeah.
For sure. So at the foundation of our cardio test is what we call our CPET RMR. So it's our cardiopulmonary exercise test. So this would be, you could think of it as like a VO2 max test, but it's a little bit more than that, or I should say a lot more than that. So you're probably familiar with VO2 max. Kind of a buzzword in the health space, but essentially it's a measure of your physical fitness ability, how hard, how long you can push kind of at your maximal rate. And so we're able to measure that. We put our clients on the bike and we put them through a protocol, and they kind of work up to their max, and we're able to give them their number. This is what your VO2 max is. And that's important because we know that VO2 max is correlated with better longevity. The higher that number, the lower your risk of all causes of mortality. And there's really not like a peak. The higher it goes, the more benefit you get. And so it's a great way for us to benchmark our clients and then to continuously follow that to ensure we're continually working that number upwards. They did a big meta-analysis several years back, and really for every 3.5 points you increase your VO2 max, your all-cause mortality dropped by about 13%. So pretty significant effect that it has on mortality and therefore longevity. So that's kind of the benchmark. But we get a lot more data than that. We also get a look at how well your heart's functioning. So we can see things like maximal heart rate, the strength of the heart. We get a sense of if it weakens at all during exercise. So if we see any weakening in the heart, it could be some issue with a blockage, with the structure of the heart, a valve, or it could just be the arteries in the heart aren't functioning like they should. And that's something that we call endothelial dysfunction, which essentially just means that they're not, the arteries don't dilate enough to incorporate more blood flow so the heart can continue to pump. So we can kind of decipher all these things out to determine is there any subtle weakening in the heart, and then kind of direct further testing and treatments based on that. Also tells us about the lung function, blood pressure, then we get a look at mitochondrial health, as well as thyroid health with the metabolic rate testing. So lots of things packed into this one test. It's kind of our foundational benchmark test in terms of cardiovascular health.
And can you repeat the name of that test again?
We call it CPET, C-P-E-T. It stands for cardiopulmonary exercise test. And then a part of that is RMR, resting metabolic rate. And so we get everybody's resting metabolic rate because that's a benchmark for their thyroid health. And so it's really the gold standard for how well your thyroid's functioning. We've diagnosed lots of low thyroid, hypothyroid just from that, and seeing people have a low resting metabolic rate. We know that their thyroid's likely off, even if their blood marker values show normal. We've diagnosed a lot of people hypothyroid that way. So a very sensitive marker for that. And so that's a really great utility of that test.
How often do you hear this? Oh, my primary physician told me my, THS, oh, my T.
TSH, yeah.
It's a long day, and I got no air conditioning. Bear with me. Okay, it broke a couple days ago. So your TSH test said I was fine in my thyroid, and then when you dive deeper, you notice it's not.
Yeah, fairly common. So we had a guy here maybe a month or so ago. It was that exact story. He was I think he was being treated on a little bit of thyroid, and his doc was saying, it's fine. Your numbers are great. Your TSH is great. We don't need to adjust the dose. But he really was still feeling symptoms of low thyroid. And when we did his resting metabolic rate, it was super, super low. So we were able to really adjust and optimize his dose, feeling lots better. So that happens a lot.
Yeah, it happens a lot. I mean, there's so many people affected by thyroid issues that their primaries do not grab that either. And that's where I learned of it, going to a naturopath many, many moons ago.
Yeah.
For those, if you don't know, thyroid stimulating hormone was the THS. For the listeners who didn't know, Luke, yesterday I was so interested and excited to sit in at Gladden Longevity on what you call the revelation meeting. And that's where after someone goes through 2 days of testing, they get to see all of the results. And one of the cardiac tests, and I don't know which one this is, that I thought was so cool, actually showed the image of the artery. And then if there is plaque, if it's inside, if it's outside, where in the artery it is. Which cardiac test was that?
So I think you're referring to the one that we call max pulse. And so that's one that looks, essentially the way it works is we put a little pulse ox on the finger. So most people are probably familiar with when you put the little thing on the tip of the finger, it measures your pulse and your oxygen. So a similar thing, we put that on their finger, and it measures the pulse coming in, but it also measures your nervous system. So we get a look at how the nervous system's functioning. So is it balanced? How much power's in the nervous system? And we can kind of talk through all of that. But then it also measures and analyzes how the waveform of the pulse as it comes through. And it measures the waveform. It can tell us, is there any stiffness and resistance in the artery, or is it smooth, it's elastic, it's looking normal? And so that test then kind of gives you a readout on the bottom. If your arteries look normal and they're supple and they're elastic, you get a low score, or if it's really stiff, you get a high score, and it kind of graphs below that, sort of a picture, like a cartoon of what the arteries could potentially look like. It doesn't mean it looks like that, but the higher the score, the more stiff the vessel, potentially the more plaque that's there, and so it kind of shows more plaque on the higher scale there. So that was it's more of a picture representation of what it could look like, not what it actually is.
Okay, so it wasn't an actual image of his artery.
Not an actual image of the artery. The other one that is an actual image of the artery that we do for some clients, and this may be the one that you're referring to, for people that we know have high cardiovascular risk, and or are concerned for blockages, or when we do that CPET test, that exercise test, we see a lot of dysfunction. We can send them for what's called a clearly CTA. Clearly heart scan, and that's the one that you're probably referring to. So if we see lots of risk, or we see lots of dysfunction on that exercise test, we'll send them for the clearly CTA, and that's a test, basically a CT scan. They give contrast and actually look at the arteries of the heart. And then through kind of AI and computer modeling, they can actually show us what the artery looks like, and then how much plaque is there, how what percentage of the artery is being blocked, and is the plaque hard plaque, soft plaque, mixture of plaque, and really just fully analyze, how you're doing cardiovascularly in terms of blockage. Super useful test. We had a guy in here probably a month ago. Wasn't having any symptoms of chest pain, nothing. It had been a while since we had looked at his. He had some risk factors for cardiovascular disease. Thank God we checked it. He had like a 99% blockage in his LAD, the classic widowmaker. And so he's going to get a stent in like a week to fix that. But that's the utility of that test. We found it out before there was a problem, and we're going to be able to fix it before he had a heart attack. That's where we're at now with screening, cardiovascular screening, all that's available. We just need to utilize it, I think, more for people to be able to, really prevent things. Classic preventive medicine right there.
And then the standard, I think, is the Cleveland heart panel that you use for the blood work and the inflammatory
Yeah, so in terms of
markers.
blood work for cardiovascular, looking at lots of cardiovascular markers, the Cleveland panel is kind of our go-to. It contains all your traditional blood counts, metabolic panel, but it also is gonna have your lipids, so your traditional cholesterol and your extended cholesterol panel. So it'll have things like your LDL, but we know that the LDL is not the full story. We also want to know what your LDL particle size is, and particle number. We want to know what the small LDL particle number is going to be. Your ApoB, your lipoprotein little a, your HDL function. All these are much more indicative of your risk than just your LDL.
Hey, Doc, can you dive a little deeper into that? So let's say somebody goes to their GP, their general practitioner, and they order a metabolic profile, and it gives them basics of their blood sugar, their cholesterol. What's the difference in what these deeper profiles or tests are doing versus that? Because I think, you know how many times I work with somebody and they're like, well, I got high cholesterol, that's bad. And, is high cholesterol bad?
Yeah.
Or is it other things that are more important than the cholesterol?
Right. It's very nuanced. So if a high cholesterol can be bad, but it's not the full picture. It's not the full story. There's lots of other factors that are going to play into that. So in terms of cholesterol, it typically, when you go to your primary doc, they do a physical or they check your blood work, they're just going to get your basic cholesterol panel, your total cholesterol, your LDL, your HDL, triglycerides. That's really all kind of you're going to get. So it's okay. It can tell you some things, but they're going to say, hey, your LDL's 150. Let's put you on a statin. Maybe that's indicated, maybe that's not, but you need to go off of more than just that LDL. So more specific than the LDL in terms of your risk for cardiovascular disease. You can break that LDL apart and actually show what the small LDL particles are. We know those are the ones that are more indicative of your risk for cardiovascular disease, is your small LDL particles. So what are those, the number of those particles? Also your apolipoprotein B number, that's kind of a specific kind of part of the LDL. How high is that? That's more indicative of your risk. If that's normal and you have a normal or close to normal LDL particle number, I'm less concerned about your risk for cardiovascular disease, regardless of what your actual LDL number is. So you really need to know what those values are. Your lipoprotein little a or LP little a number, that's really just determined by your genetics. And so if you have a high LP little a, much higher risk for cardiovascular disease. It makes your blood clot more stickier platelets. And so you're much more higher risk. So if you have a high LP little a, probably we're going to want to be more aggressive at lowering some of your cholesterol numbers. If not, then maybe not. We don't have to be quite as aggressive. That's one piece of it. And the other piece is you have to look at your inflammatory markers. So do you have inflammation? Is there inflammation in the plaque and in the blood vessels? because if you have inflammation there, then much higher risk of those plaques rupturing, you having a heart attack. If not, then again, I'm not as concerned with what your actual cholesterol numbers are. So you got to look at the inflammation. Is there insulin resistance going on? There's lots of things that go into play to kind of determine your overall risk. I think we've really kind of just gotten into treating the number. LDL is high, put them on a statin, which sometimes maybe that's necessary. Sometimes they have high risk, lots of family history. That's important, and that's going to be good for them. But a lot of times, probably not. It's probably just reactive, and you're just treating a number and reaching for the easiest thing, putting them on a statin. So we have the tools now to decipher this out, to determine who needs a statin, who doesn't. I think we just need to utilize it better and utilize these more in-depth testing to really see who needs these things. And then add one final piece, look at their genetics. Some people respond well to statins, some people don't, and we can figure that out by looking at their genetics.
So just to be clear, if they were to go to their traditional general practitioner, they would not get this type of in-depth test, that they would not.
Probably not. Now, it depends on the PCP. There are some PCPs who sometimes do run these advanced lipid tests. And so it depends. I'd say the majority, no. If you find a good one who will run this for you, I'm sure there are some out there, but it's definitely not the norm.
Kelly?
Yeah, and the lipids, people always think how they affect the heart, but they also affect the brain and other systems. So it really is an important test to break down.
Absolutely.
And I know there's probably others that you do for the heart, but just in the interest of time, can we move on to some of the brain tests? Because at our age, the cognitive function is really important, and things like Alzheimer's and so on. That is really something important.
For sure. So again, I'd say kind of the baseline, or a couple of the baseline brain tests that we do are one called the CNS VS, we call it, or CNS vital signs. CNS stands for Central Nervous System vital signs. And basically, it's just a comprehensive memory test. It's really kind of all it is. You sit at a computer and you go through the test, and you do a bunch of questions and memory, and it tests your speed and your processing ability, lots of different categories, and then gives us a readout at the end of how well you did, like kind of a composite score and then a score across each section. And then we'll kind of plot that as being above average, average, low, average, poor. Kind of gives you a readout across all areas, so we can look at that and get a good baseline. Where do you stand? Is your brain sharp, fast, good memory, or are we lacking in certain areas? And then based on that, we can do further testing, or we can try to figure out what's affecting the brain. I mean, the brain's affected by so many different things: stress, sleep, diet, micronutrients, thyroid hormones. I mean, really everything. Everything we do can be connected to your brain. And so we have to really look in depth to see what's affecting it and what's maybe making it not function so well. But that's our first clue in of how we're doing brain-wise. And the second thing we look at is an actual EEG, or electroencephalogram. It's basically looks at the brain waves of different areas to see how well you're functioning across different areas. And we can tell based on that and the analysis of those brain waves, if certain areas are functioning at a lower energy level than they should be. And so those are kind of our first two tests that we do to really get a sense of how well people are doing from a brain cognition standpoint. And then we go hunting from there. What's the root of this? How do we fix this? But that's kind of where we start.
We definitely want to do a show on how do we fix this. Mark, you want to fly to Dallas and do the CNSVS test with me? Let's see how smart we are, how good our memory is.
Absolutely, for sure.
Yeah, for sure. And then from there, we do.
Sorry,
we do
I didn't
have.
interrupt you, Dr. Luke.
Oh, you're good. Go ahead.
No, go ahead. You were
Okay.
you were
I was just
rolling,
going to say, those kind of give us a sense of overall where do we stand, and then the the hot topic that most clients are concerned about in terms of their brain is like, what's my risk for dementia? Am I showing signs of dementia? What's my risk there? So for that, we can do a blood biomarker test to actually look at precursors, biomarker precursors for dementia. These have been validated. These are new, and so we work with a diagnostic company where we can run these biomarkers and get a sense of risk for developing Alzheimer's 10, 20, 30 years down the road. So if we know that there's potential risk there, we can then do things to mitigate that. So that's kind of a piece of that. And then we also look at genetics. So genetics are involved in dementia and Alzheimer's, and so we're able to get a bunch of different genetics to see someone's risk there, and then can do things to mitigate that risk. So a couple of other pieces specifically in terms of dementia. It's a mixture. I'd say it's a mixture of both. I can say it's part of it is hereditary, specifically the ApoE4 genotype. That's more commonly thrown out there. So if you have ApoE4, specifically if you have 2 copies, much higher risk of developing dementia. You're not guaranteed to develop it. So there's still lifestyle things that contribute, but much higher risk. So if we know you're a ApoE 3-4 or 4-4, if you have 2 of the 4s, then we can be much more aggressive in terms of what we do to prevent you. But to speak to your point, it's a combination of both, right? And it depends on some of those specific markers, specifically the ApoE4. Yeah, that's one of the tests. So we work with a genetics company called Intelix DNA. They kind of test a bunch of different SNPs, or single nucleotide polymorphisms. They're basically just single changes in your DNA that can cause either positive changes or negative changes. It can be good and bad. And so they have a whole brain panel where they have a bunch of different SNPs related to dementia, Alzheimer's. And so the ApoE4 is one of them, but there's a bunch of different other ones. So we can pull that up and look through and say, you've got this. And so what's nice about these SNPs, though, is that they're actionable. So if we know you have certain ones, we can do certain things or avoid certain things to affect that and maybe make it not as effective on you. So it's not just we know you have risk, but there's actually stuff we can do about it with the SNPs that we test.
So how much is, from a lifestyle standpoint, things like excess insulin or inflammation in the brain affecting or accelerating that process?
Very much. I mean, so aside from some of the things like ApoE4, which is, it really relates more to like risk from cholesterol, but most of the other genetic risks for dementia are centered around inflammation. So you've got higher inflammation in the brain due to different ones, hormones. So we know that if you're at risk for low estrogen states, so both primarily women through menopause are affected from low estrogen states, but also men are affected by low estrogen states. So if your testosterone drops, your estrogen is going to drop as a man, because men need estrogen too, and we get estrogen from testosterone. And so there's men who have low estrogen, and that's super important for your brain. So if you've got issues with estrogen, that's going to be important for your brain. And then mitochondrial health is another big one. So if you have issues with your mitochondria, then that can play a role in the development of dementia and Alzheimer's. And so those are all the different categories. That's not exhaustive, but those are some of the big ones that we see with a lot of the genetics that we test.
And there's an interesting study that came out the other day on aspartame and artificial sweeteners, which I just can't stand. I've been on that case for so many years, that not only does it lead to increased stroke risk, but I think they said it increases the inflammation in the brain. So I believe 20 years from now, they're going to say that a lot of these artificial sweeteners definitely didn't cause this epidemic that we're experiencing, but they certainly didn't help it for sure. So what's your
No,
thoughts on that?
I certainly agree. I think there's lots of things just environmentally that we're exposed to, just chemicals and things that just shouldn't be in our bodies, and it just creates inflammation and so yeah, definitely. I think we're learning that more and more, that we're kind of filling ourselves with different chemicals, environmental things that probably shouldn't be there, that are kind of
As I
having
drink my
negative
coffee.
effects.
So.
Yeah.
And Luke,
So.
the advancement of these tests are so amazing, especially you mentioned that AI is being used, but for people who either they were adopted, they didn't know their parents died when they were young, they never had those conversations, or, even for myself, my dad had a heart disease, but he was a smoker, he was a drinker, he never exercised, he was highly stressed out. So I always wonder, like, is that really a risk for me, or how much was, his lifestyle versus the lifestyle that I have? So I appreciate you going through those brain health ones. And I think you also do one that is emotional health as well, a panel that also not just is the neural, but the emotional.
Yeah, in terms of genetics, or you
Just
mean
brain health.
checking brain health? Yes,
Yeah.
yes. So that one we call our neural check, and essentially it really looks at the how your nervous system is balanced, and so we with our nervous system, it's kind of split into two different sections, you could call. So you've got your sympathetic nervous system, which is the fight or flight, like a bear is coming at me and I'm, got to fight, I got to run. And so your sympathetic nervous system is activated. And then the parasympathetic nervous system, that's the calm, rest, zen, peaceful state. And so those two, should be in balance with each other. We don't need, to be over sympathetic, and we shouldn't just be fully parasympathetic. You need a bit of both, but you want nice balance there. Primarily, probably a little more of parasympathetic than sympathetic. And so the test that we do called neural check really just measures that out, the balance there, and then it measures the amount of power that you have in your nervous system. We know that the more power we have in our nervous system, in the vagus nerve, really is what we're kind of measuring, the more we can manage stress. So stress is going to come. We're all going to have stress, but the better you can deal with it and manage it and not allow it to overcome you and just be living in that stress state, then the much better you're gonna do. The nervous system is connected to everything and plays a role in all parts of our bodies, and so you want a really regulated nervous system because it's going to affect everything.
So that's called I'm sorry.
Yeah.
NeuroCheck is the name of the test. I want to make sure everybody gets
Neural,
the name.
Neural check.
And is
It's
that
by
your branded name of the test?
No, it's from a company called Brain Tap. We use their device as a way to meditate and regulate the nervous system. And so this is a way to test it and measure how that's effective, how that Brain Tap is affecting you. And so yeah, that's the test that we use.
How is it scored? Is it like a number score, or does it say you're here, or is it homeostasis, or like a balance beam, so to speak?
It's more like that, yeah. And there's several different graphs basically. So you get a pie chart of how much sympathetic, parasympathetic, and then the combination of the two. And then you get a readout for what your power is. The higher the power, the better. The more energy in that nervous system.
That's exciting.
A graph for how well it's balanced. You get a graph for how the nervous system and your adrenal glands are functioning. If you're under chronic stress, we know that balance is going to be way off. So we can see if there's chronic stress. We can see the different frequencies of the brain waves. So You may have heard of delta, theta, alpha, beta, gamma brain waves. So delta is primarily sleep. So we'll measure how much delta you have. You shouldn't have much. And we do see people who have a lot, indicates their brains are tired, they're inflamed. So we know we need to work on that. Theta is like a deep meditative state. Alpha is more of a lighter, relaxed meditation. Beta is where most of our brains are at right now, as we're just talking. And the gamma is the flow state. So when you're like in the zone flow state, whether you're exercising or something like that, that's gamma. And so what's cool about the device BrainTap is that you can choose one of those areas to dial your brain into. So we like to recommend do alpha in the morning and do theta in the evening. And essentially the headphones and it's got this little visor thing. It dials your brain into the frequency, and it really regulates your nervous system and builds power. And so we have people who really improve their scores dramatically when they utilize this. And just simple meditation improves all of this too. But meditation can be hard to learn for a lot of people. It takes lots and lots of practice. So this is an easy way to do that and get those positive effects by just wearing this headset.
Yes.
And I think you said a key point is that meditation for a lot of people is so difficult because your brain and your body's saying, go check your emails, go do this, go do that. And,
right.
I think that's phenomenal. I'm
Yeah,
excited.
it kind of distracts you into it.
Yeah.
Like it's playing music and there's kind of flashing lights and you just close your eyes and it just kind of pulls you in.
So like we said, this is meaty topic here. A lot of note taking, but you can get a lot out of this. But I'm like a kid in a candy store right now.
I know, me too. Yeah, and we want to put the links in with the show notes too, in case people want to get that brain tap. You can get it through Gladden Longevity. I have done it. So I actually did the test, and I will say I was 15 years younger than my chronological age, but I want to be 20 years younger, 25 years younger. And
yeah, we have clients who are way, way younger.
So let's talk about the difference between a chronological age and a biological age and why that's so important.
Yeah, no, that's a great question. That's kind of that's definitely a buzzword and out there in social media and things. So chronological age is just your actual age, your birth date, how old are you? Biological age is really a measure of how old is your biology through different lenses, through different measurements. So we can calculate different biological ages. There's many, many different ones. So the one we were just talking about is your biological age of your nervous system. So it could be older or younger. So if you're super stressed and your nervous system's real dysregulated, then you'll have a much older nervous system. But if you're really dialed everything in and you get great sleep, manage your stress, exercise, you'll probably be much younger. Like Kelly is 15 years younger in her nervous system. So that's kind of the difference. There's not one biological age test that's better than all the others or trumps all the others. There's a bunch of different ones out there. We do several of them because you want to get a sense of where you're at across the board. You might be good at some, older at others, and so it's good to get a broad look at different things. And so that's sort of the difference of kind of the biological versus chronological.
So one of the things you measure is telomeres. That's one of the markers. Can you tell people how that's measured and what that's measuring?
Yeah, so a couple different of our tests of ours do telomeres. So we do one test that directly measures them. That's probably the most accurate test. It's directly measuring a telomere. I guess we should probably explain what a telomere is. Basically, a telomere is like a protective cap on the ends of our chromosomes or of our DNA. Every time our DNA divides to form a new cell, those telomeres shorten a little bit. And they divide again, shorten a little bit, shorten. So that effectively limits the lifespan of a cell, is the length of their telomeres. So that as they divide, it shortens. And when it gets to a critical length, then they can't divide anymore. And the cell dies, or it becomes senescent, is another kind of buzzword. A senescent cell doesn't die, but it's effectively dead. It's not doing anything useful. When it becomes senescent, it will give off different inflammatory proteins, and it just wreaks a little bit of havoc everywhere. It causes aging. So that's what telomeres do. So that being said, we prefer and we want longer telomeres, because that means that biologically your cells are younger. And so we can directly measure telomere lengths. And so what our tests will show is the median length, so what's like your middle telomere length, but then more importantly, will show us what the shortest 20 percentile is. That's really the measurement we look at, the length of the shortest 20% of your telomeres, because we know that subset is actually what drives aging, just based on studies and different things. The shortest 20% is really what's causing the problem and driving your aging. And so if you're short there, then we can do different things to lengthen telomeres. So diet and lifestyle, exercise, all that, very, very important. Removing things like toxins that can be contributing. But then we can give you certain things, certain supplements to actually lengthen them, to activate an enzyme called telomerase that will lengthen the telomere. And so we do that for some of our clients, and we can see the telomeres actually lengthen out. Now we have to be safe with that. We don't want to use any telomere lengthening medications or supplements in anybody who might have cancer or at high risk of cancer, because we don't want to lengthen telomeres on cancer cells. We don't want to make them more resistant to dying. So that's kind of a caveat to that. But we're pretty thorough in the way we check for cancer and screen for cancer, and so we feel pretty confident in utilizing those supplements if we need to in those people who are much lower risk. But yeah, that's what telomeres are. That's kind of how we approach it, measure it, and even can treat it in certain folks.
Yeah, I love that we can get to the details of cellular aging. I think another longevity test you use is the true age or glycan age.
Yep, those are another two of our kind of core tests. So true age looks at DNA methylation. And what that is so we know we have the DNA, it's that double helix structure. And so what the methylation refers to are these little methyl groups that get added on the structure. And the way and the pattern of those methyl groups is very predictive of aging. So we can measure the methylation and the patterns, and that predicts your age. And so that true age test will give you a DNA methylation age. Say, you're 50 and your methylation age might be 55, or it might be 45, just depending on how that looks. And then it also will give you different aging, the age of your different systems. So your cardiovascular system will have an age, your lungs will have an age, your kidneys, your hormones, your immune system, brain, all of that will give you a DNA methylation age. So we can drill down on that and see, okay, cardiovascular is your highest age here. That's an important area for us to probably focus on, and we can then kind of go back and cross-reference our other cardiovascular tests. What is the issue here? What's maybe driving this age? So we use it as a nice kind of cross-referencing tool. Where are our highest ages? How does that correlate back to all of our other testing? We start putting pieces together. It's very much a puzzle piece with everything we do. We've got to look at this, pull this in, fit everything together. But that's really what makes it fun. So
it is an art and a science
is,
together.
yeah.
It's a symphony.
Can I just ask a few questions on methylation? So it's probably the biggest buzzword in the last 24 to 36 months has been methylation testing. And, I know you touched on it for aging, but can you kind of break down, what are some of the different things that you test for in a methylation test and how they affect the body in a negative way, removing toxins or stress or whatever it may be? 'Cause I know some influencers have really brought this to the awareness, and I think it's fantastic. I think Gary Breck was the first guy I heard talk about methylation tests for the most part here.
Right.
So he
So
takes a lot of heat for it, but
yeah,
he has a way of really putting it so that, the average person says, okay, I get it. And he's a darn good salesperson too, no doubt. And I'll give him that. So.
yeah. So what that is he's actually referring to, and it's a little bit confusing because it's the same word. So what he's referring to is how well you methylate, just in terms of regular enzymatic reactions, which is a little bit different from DNA methylation. It's kind of a separate thing, but still very applicable. So what he's kind of referring to in terms of methylation is some people don't methylate their enzymes very well. And so they need the right B vitamins and the right folate. They need methylated versions that they may not be getting through their diet or even through their vitamins. And so they're not going to methylate well in terms of how they're activating these enzymes. So that then their metabolism's not running as well due to that. And they're having issues. They're having higher inflammation, higher homocysteine. They're having anxiety, depression. Lots of different things can be tied back to methylation issues. And really it boils down to genetics. I mean, we test all of that in people's genetics. So we can really know, how do you have issues with methylation or not? And if you do, here's exactly what you need in terms of the right supplements, getting you the right forms of B12 and folate and even folinic acid, which is kind of a more activated form. So we can really drill all that down just by looking at genetics and different biomarkers. But yes, that's definitely a very important thing, very much a buzzword. But it's actually a little not the same thing as the DNA methylation, even though it's the same word.
Okay, so the type of test somebody would do for something like that is different than the DNA methylation.
Yeah,
test.
the DNA methylation, just an aging, gives you that biological age. When we're talking about like how well do you methylate, then we're going to want to look at genetics, and then you're going to want to look at things like homocysteine. If you have really high homocysteine, you don't methylate well. And so those can be, the homocysteine is the easiest test that you can do to actually look at that.
And I think that's where I was. My homocysteine levels were off, so my naturopath put me on B12 and is it folate acid? I think, yeah.
Yeah.
And that,
you want to be on methylfolate, because that's the methylated form that will actually help lower that. So yeah, the B vitamins, the methylfolate, methyl B12, even things like creatine actually can help you methylate better, lower the homocysteine. So yeah, homocystine's on our Cleveland panel. We're always tracking that.
So explain the difference in a regular vitamin and a methylated vitamin. Did I say that correct, Dr. Luke?
Yeah, you said that right. So basically it has to do with if someone doesn't methylate well, and that's important because you need to methylate some of these like folate or B12 for them to be active and to actually perform their proper functions. And so genetically you may not be able to do that very well. And so if you take the wrong, not methylated B12 or not methylated folic acid, then you're not helping. You're kind of feeding the wrong enzymes, and you're not helping the actual situation, because they're going to feed into the system, but then they're not able to get methylated. So if you're feeding the methylated versions in, they're already activated and they can just go and do their thing. If you're not someone who methylates well and you take the non-methylated versions, you don't activate them. So it really is, I guess, a matter of if you can activate them or not. If you can't activate them, then you need to just take the activated forms.
So most of your store vitamins are not worth the label they're on. So.
Yeah, probably. I mean, there's some good ones out there, but yeah, a lot of them are probably just have like folic acid, not activated, and there's a lot of people who probably need methylfolate, especially women trying to get pregnant. That could be a huge issue if you're just taking, if you have MTHFR SNPs and things, you're not methylating well, and they're taking just folic acid. maybe they're not able to get pregnant and they just need to make the switch to methylfolate and then they get pregnant. I mean, that happens a lot to people.
Wow, and you don't know if you don't test.
Yeah, I know.
Speaking of testing, another area of interest for our age group is the bones, bone health. So I know you do some full body scans that look at bone and body composition. Can you talk about
Yes.
those?
Yeah, so we do a DEXA scan that you would get, at your, typical, a lot of PCPs, and we'll do DEXA scans. And so we'll look at your bone density through that. So we'll look at the bone density of the spine and the hips. Those are kind of the 2 points where you're prone to weaken and have more at risk to have a fracture if you weaken there. So we'll look at bone density of those spots. And then that same scan, that DEXA scan, can then actually look and analyze your body composition. So it can tell us how much visceral fat, so fat around the internal organs you have, which is not good. The more of that fat you have, the higher risk of insulin resistance, cardiovascular disease, metabolic disease, dementia, lots of just chronic disease. So it's a very important thing to track and know. And then how much lean muscle mass, what's your percent body fat, all those sorts of things. We get all that information on the DEXA scan.
Yeah.
So, and then that's kind of the bread and butter there. And then based on that, then we can dive into, do we need to work on building your bone density up? Are you showing signs of osteopenia or osteoporosis? And then do we need to work on your body composition? Are you, percent body fat's too high, you got too much visceral fat? We need to work on building your lean muscle, those sorts of things. It's very, very important to know all that and optimize that.
Yeah, and to the listeners, we can't stick our head in the sand. You're not going to know if you're having osteopenia, osteoporosis necessarily until you break something. And bone is not easy to build. You don't want to wait until you find out it's in both your hips and your spine. And like the early detection really does make a difference, because there are things you can do. Like I know you have the OsteoStrong program and there's supplements, which I actually got on because I had the DEXA scan done and I did show signs in my hips and I wouldn't have known. So just
Yeah.
to the listeners, don't put up with, maybe my hips ache a little or I'm just losing flexibility. Get tested. It's important.
Yeah,
And Dr. Luke,
absolutely.
we don't want to miss out on some of the functional medicine and cardiovascular health, like the whole gut biome. That's another big area. Can you talk about those tests?
Yeah, for sure. So gut testing, again, another big kind of buzz test. But we do comprehensive gut microbiome testing. So we'll, collect stool samples and we kind of analyze that comprehensively. And so we'll be able to see, number one, is there anything in there that shouldn't be? You have any bugs, viruses, parasites, anything like that? And then we can eradicate, stuff that's there that shouldn't be. And then two, is there too much of the good stuff? So you can have actually an overgrowth of just your healthy bacteria. You can have something called SIBO, small intestinal bacterial overgrowth. Or even there's SIFO, small intestinal fungal overgrowth. And so these are the kind of things that just lead to kind of chronic bloating, belching, just kind of like, my stomach just is off. It's just, I kind of have a sensitive stomach, or people who maybe have IBS. A lot of this traces back to SIBO or SIFO, so we can detect a lot of that. And then we can see, is there inflammation? Is there issues with digestion and absorption? And then are there problems with leaky gut? Lots of people hear that, again, another buzzword. Essentially, it just means that, are the cells lining your gut, are they open to where things can kind of easily pass through? And so if things are easily passing through, increases inflammation, autoimmunity, and it's not a good thing. It's tied to lots of chronic issues. Gut is tied to really every sort of system. I mean, it's very connected to your brain health, your cardiovascular health, immune system. It's very, very key, and we kind of disregard it a lot, I think, but we do comprehensive tests there, and we can we can then, after we see what's going on, we can kind of stepwise put you on a gut regimen to correct some of this stuff. Gut takes a while to correct. It's not an easy, quick fix. You kind of have to stick with it. The diet, the supplements, everything's got to be dialed in, and it takes a while, but we can move you in the right direction.
So when it comes to leaky gut or some of the other issues you mentioned, what's the correlation to all the autoimmune diseases in that?
Yeah, I think very correlated. I mean, I think that's something that's actively being studied, but there's lots of evidence that it is highly correlated to autoimmunity. So people who have lots of autoimmunity, there's definitely a strong correlation with leaky gut. So is that the actual cause? Does that just propagate it and make it worse? I mean, it's hard to say, but there's definitely a link there. And so fixing it is very, very, will it make your autoimmune disease resolve completely? Maybe. And some people that happens to them, but it'll absolutely make it better.
So explain leaky gut, how that is affected. So you have these junctions and there's little holes that develop in those membranes, and the food doesn't get digested. So maybe you could do a better job than I do, Dr. Luke, on this. I'll explain it in my very simple format here, but it works for me. But I'd like to.
No. I mean, that was really a good explanation.
I just
really
pretend it's a glass with holes in it, and you pour water in it, and it leaks out. And
yeah, I mean that is
holes,
essentially.
Yeah, you
right.
don't have the undigested food, so.
Exactly. So anything in the gut, whether it's food or just bacteria, even anything that's there, can potentially go through, get into your bloodstream, and then that's a foreign thing. The body reacts to it, so it creates antibodies against it, and then when you create antibodies against something, then that can then develop into autoimmune problems, where that antibody against this looks similar to this tissue or this organ, and so then you start attacking that organ, and that's autoimmunity.
So in actuality, you could eat food, it gets undigested, goes into your bloodstream, your body reacts to it as if you have something toxic in your body, and it's really just the food that's not properly assimilated in the body, correct?
Correct. Yeah, or like a piece or protein there that it's identifying the immune cells. Their purpose is to kind of identify foreign invaders, and they say, "Hey, foreign, attack that. That shouldn't be here." And they go through their whole sort of propagation, and antibodies get developed, and then boom, creates inflammation because it's trying to suppress that. But sometimes that process goes haywire, and then you get autoimmunity.
So how common do you find that when you're testing?
Very common. Yeah, I'd say the majority of people have some degree of leaky gut.
And do the food sensitivities go along with that? You test for all the food sensitivities?
Exactly. So
allergens.
Yes, I'm glad you brought that up. So the important piece of testing the gut is also testing the food sensitivities. And so we do a test called the MRT or mediator release test. So it's a very specific type of food test, and it's looking at, do you create an immune response, so inflammation, prostaglandin release, histamine release, to specific foods. So a bunch of different foods, and it gives you a readout: green, yellow, red. Green, no reaction; yellow, moderate; red, you had a big immune reaction to. And so we just tell our clients, if it's yellow or if it's red, do your best to avoid it. You avoid it for about 6 months or so, and then a lot of the time these reactions will go away. Then you can go back to seeing those foods. So what happens is our bodies like variety. If we're eating too much of the same thing all the time, eventually we'll develop an immune reaction to that.
Wow.
You should be eating lots of variety, rotating things around to avoid this reaction that can happen.
So a histamine response, I guess the best way to relate to that for somebody is if you get allergies during an allergy season and that's how crappy you feel, that's what goes on in your body. I think we've gotten so conditioned as we get older, based on the medical community, to say, well, this is fine for your age. This is the way you're supposed to age out. And you and Dr. Gladden are like, heck no. You don't have to age out that way, right?
No, absolutely not. You shouldn't accept that answer. That's not what we should be. That's not how we should be responding or talking to our patients. Just say, yeah, this is normal for your age, because it doesn't have to be. I think we can age in a much healthier way and feel and act young. Yeah, don't accept that.
I just triggered Kelly, so if you didn't notice that, so
No,
that was a
I'm just
trigger for
thinking.
Kelly.
I'm thinking about our audience. I'm thinking about the people listening, and we don't want them to become overwhelmed by the test. But at the same time, if you're noticing, oh, my belly is just disrupted and bloated, and you don't put up with, well, I'm just gassy, or I just have brain fog, or I get it tested, find out, because there's things you can do about it, and a lot of it coming down with lifestyle and naturally.
Absolutely.
And while we're kind of going down the list and thinking of tests, is the environmental things. So things from the outside, toxic
Yep.
burden, heavy metals, chemicals, just the world that seeps through our largest organ, our skin.
Yeah.
Can you talk about that?
For sure. Another big one that we do, we kind of call it our total toxin burden. It's a combination of environmental toxins, mold, and metals. So environmental toxins, stuff in the environment. So that's pesticides, herbicides. It's stuff from your household products, your soaps, lotions, toothpaste, all the chemicals in those things that we shouldn't be exposed to or can cause issues. It's VOCs, volatile organic compounds, so stuff in the air that's not healthy. That's kind of what we get in our environmental toxin panel. And then we've got our mycotoxins, or your mold. Lots of people deal with mold and don't really know it, and it kind of creates subtle chronic symptoms for them, maybe some fatigue issues, some brain fog, maybe some chronic allergies that's tied back to it. So especially people who aren't really great with detoxification, and we can tell that by their genetics, have lots of mold, lots of toxins usually. And so we'll see a bunch of mold here. And so we'll have them go get their house tested, figure out where that source is so they can get the source out of the way. And then we can work with them on detoxing that. And then the heavy metals that you can usually water. Water is probably a source for a lot of people, heavy metals wise, but air, soil, different environmental exposures. Mercury is a big one. That's probably our biggest one that we pick up, either through fish, so high mercury fish, or if you've had a mercury filling. So our older clients that, they used to do mercury fillings back in the day, they still have them. Years and years of chronic mercury accumulation and exposure, they're just kind of full of mercury. So we have them go get those taken out with a biological dentist, where they can kind of safely remove that and not expose them to more mercury as they go through that process of pulling that out. And then we have them detox the mercury that is kind of left over and stored in their tissues from that. So mercury is a big one that we find. But yeah, that's kind of the the toxins that we see a lot of.
Which one of those tests would really hone in on the liver? I mean, I'm a big fan of helping people with non-alcohol fatty liver disease. Why? Here's why. My dad died of liver disease. My grandfather died of liver disease. So it became a really hot topic for me. That's when I did last year a whole bunch of research on artificial sweeteners, and spit out a book called Sweet as Lies, because of just wanting to learn myself. Big epidemic, silent killer. What's your thoughts on what are some of the tests that would expose possible issues with the liver?
For sure. So the easiest kind of first test is going to just be your basic liver enzymes. So your AST, your ALT, and your alkaline phosphatase. You could add your GGT on there as well. We get all of those on our Cleveland panel. But if your AST and your ALT are elevated, even just barely, that means there's inflammation in the liver. And a lot of the time it's fatty liver, especially if you're a bit overweight or if you've got visceral fat, then you could pretty much guarantee some fatty liver going on. So first look is through the enzymes themselves. Second thing would be body composition. You got visceral fat going on, then that fat's probably in the liver too. That'd be the second thing. And then the third thing would just be something like a Prenuvo, like a full body scan that's going to show fat in the liver, or even just a liver ultrasound is great at showing actual fat in the liver. And those are the easiest ways to really get a good assessment. But you can very easily and very cheaply start with just the basic liver enzyme tests. Yeah.
Yeah. I mean, you could probably go through every organ system, liver, kidney, bladder. I mean, I'm sure you have tests for all of those. And, in the interest of time, we won't have you go through all of those today. But one of the other tests that you do that I think is interesting and very unique and special to the concierge offerings at Gladden is the culture index, which is, about their personality. And as practitioners, it helps you, I guess, to know, like, how do people make decisions? What are their energy styles? How likely, how coachable? And can you talk a little bit about the culture index and how that plays in?
Yeah, for sure. This was one that when I first started working here, I was kind of like, why do we do this? This is kind of a little bit weird. We're doing this kind of personality thing on everybody, but it really makes a lot of sense. I think we do it for a couple of reasons. One, I guess I'll explain sort of the test first, but basically it gives you a sense of the personality of our clients, who they are naturally, and then who they are at work, their personality. So their autonomy, are they kind of a visionary, or do they are a team player? Their social ability, so kind of introverted or extroverted. Their pace, are they slower pace, or are they real fast paced? Like how do they work? And then are they detail oriented or not? They like to kind of focus on details, or they not like to get into the weeds with details, and they kind of like to make up their own rules, so to speak. So we see how they score in all these areas, and it uses a series of dots. And so we can see who they are, and then does work, do they have to change? So are they having to change their personality at work? And so we can see is there conflict there? And if there's conflict there, then that's a big source of stress for that client. And so it's an easy way to kind of identify that, draw that out, and help people fix that. Maybe they need to move to a different department or change jobs completely, but work is a big source of stress for a lot of people, and this just helps identify that. Because the stress is going to play into the nervous system tests, and it's so important for overall health. So this is a great way to identify that. But then secondly, it just, like you mentioned, it tells us who they are. So we get to know kind of how they function, how they like to work, how responsive they might be to change or not. So it gets us into a little bit of the psychology. So it helps us understand them better, so we can just work with them better. So yeah, twofold, but yeah, lots of information, lots of value in it.
They don't teach that stuff in medical school, do they?
Not at all, no.
So. I'll tell you, I want to add one more point to that, is that when again, I'm only a third of the way through the book. Like I said, it's very meaty. I just got it. Is in the beginning, he talks about mindset. And I think, most people just totally look over mindset. He talks about empowering beliefs, disempowering beliefs. Once I started reading that resonated with me, because it's something that if you don't have the right mindset in place, all the stuff that you're teaching everybody ultimately is moot. It's just not going to grasp. So you have to have the proper mindset. Most people think they got the proper mindset, but they maybe just have a good attitude towards their health right now. But excellent stuff. Excellent stuff.
Yeah,
so
exactly.
Highly recommend the book and everything you guys are teaching everybody, for sure. So
yeah, well, Luke, obviously what you do there at Gladden Longevity is very unique, world class, just very, very special. If people wanted to do a consultation with you to find out, more about, how they might set up testing and become a patient, what's the best way for them to do that?
Yeah, we can provide the email or phone number, and they can reach out to Grace or Holly, and we can provide more info on our different programs and more specifics on what we do. But I'm more than happy to work with whoever wants to come over here and kind of show you more what we do and dive deeper into what's going on with you. So reach out to us. We'd love to take on more clients.
Yeah, GladdenLongevity.com. There's the
GladdenLongevity.com.
podcast, the Gladden Longevity podcast. They can find great information there as well. And just want to, if you could speak to our audience just for a moment, who's this 50 plus year audience, and they want to optimize their lives, what would you say to them?
Yeah, I would say don't get overwhelmed. We talked about a lot of stuff. You might be overwhelmed, like, wow, that's a lot. How do I do all of that? But I would say maybe pick one thing. Maybe think of like one thing that's isn't right with you, or you like to optimize, you like to look more in depth on, and search out for somebody who you can do some more in-depth testing on that. Whether it's us or somebody else, go get tested, go do some further testing there. And work on optimizing that one thing. I think you got to start small, and then you can then slowly work on different areas. But that's what I would encourage everybody to do. And then never forget the small stuff. I mean, I think longevity is accomplished probably, 75% of it is accomplished through good old-fashioned healthy diet and exercise. And throw some targeted supplements in there. But the majority of this isn't through fancy devices or supplements. You accomplish the majority of this through healthy diet, avoiding the bad stuff, exercising, and controlling stress, sleep. All these things that we know. I mean, that's really the key ticket, and anybody can do that.
So I do want to add something to this, Kelly, before you continue. Is I always say this, that if you're listening to this podcast or watching this, is your intuition got you here today on purpose for a reason. There is possibly something underlying in your health that wants your attention. So don't not listen to your intuition, because it is speaking to you right now. It's telling you to be here today, and it's telling you to take the next step. And I'm telling you, these guys are the real deal. I am so excited to have hooked up with you guys. The book, I'm booking my ticket already here, Kelly. So, because I want to learn a lot more about what's going on in my body. But it's Gladden Longevity, right?
Yes.
Gladden Longevity, yep. GladdenLongevity.com.
Gladden Longevity podcast too. Really great podcast.
Yeah. Social media, you can check us out.
But you're here for a reason. So take advantage of that. Just don't listen and not be active in your health at this point. So,
yeah. And I will say, I am a client of Gladden Longevity, so obviously I am a big fan, and I recommend that you go to the website and look at some of the free resources, but also if you're serious about, making an investment in your health and your life, then make an appointment for a consultation and find out more about the services they offer, and if you're ready to really make a difference and make 100 the new 30. I love how Dr. Gladden says, you're only as young as your oldest system, or whatever the oldest measurement is.
Yeah, oldest biological age. That's right.
Oldest biological age. So that's how young you really are. So
right.
Until you know, you don't know.
That's right. That's right.
Well, Dr. Luke, thanks for showing us that aging isn't a mystery. It is not only our chronological age, but with the right testing, you can really uncover the challenges that are underlying years before it becomes a crisis. Do not wait for it to become a crisis. And thank you for helping get people on the path to not just living longer, but really optimizing their lives and their performance. We appreciate you.
Yeah, thanks a lot, guys. I really appreciate y'all having me on.
And Dr. Luke, I can't think of a more fulfilling business to be in than what you're in right now in this space, because the traditional medical space is not that fulfilling. It's just, churning numbers there and sick people.
It really, yeah, no, I'm
Just zone the heck out. But
Yeah,
what you're doing, adding years to people's lives, helping with their overall health, has got to be one of the most fulfilling things you can
very
possibly
blessed to be
do.
able to be in this as a career and to really be able to help people. Absolutely.
Yeah.
You
And I
walk
would
the
just
walk and
say,
talk.
he does. I was going to add one more thing. So just yesterday, I got to sit in on what Dr. Gladden calls his revelation, and Luke was there. And to see someone who actually went through 2 days of testing and all those tests come together, and just the symphony of the life circles and everything working together. And then to see this person leave with a plan that they can go home and do something, that this particular person was mid-50s and about to sell his company. And wow, I mean, the next 50 years will be even better than the first 50. But to watch what Dr. Luke does is just art and science in motion. It's so inspiring. I'm encouraged. So thank you.
Thank you, Kelly.
Dr. Luke, thanks for coming on. You definitely walk the walk and talk the talk, and that is a wrap for everybody. Hopefully you all got something out of this episode today. I hope you took a lot of notes that you could take your life to the next level. In the meantime, thank you all for checking us out. We will see you all in the next episode. Bye-bye now.